Hey, this is Dr. Sebastian Gonzalez with Performance Place. We are in Orange County, Huntington Beach area over in California. This is one of the only places where we can actually get the doc on the phone and be able to have a good conversation about some of the stuff you have going on. So we do our very best to keep that standard high. I believe that good health care starts with education, and I do my very best to educate my patients and friends about what they have going on. So this is what these podcasts are, and any of the email feeds as well. If you have not gotten on the email feeds, go onto our website. There is a email feed that you can just put your email in and just get a bunch of free information, and hopefully it helps you along the way. So today is the second part of the talk about hip injuries, or hip FAI, which is femoral acetabular impingement, or also, we consider this as a beginning stage of labral tears, since we learned at the last podcast that labral tears of the hip, or cartilage tears of the hip, don't have to happen with trauma. They can happen with microtrauma. So sometimes repetitive injury, repetitive strain, or putting a tissue past its load capacity can create these issues. So I'm recapping again the things that I learned at one of the research updates that I went to last year, and I wrote an article on this, and I have all the references. This one is based upon, let me do a little name dropping here. This was an article by kinematic this is the Google term you can search, kinematic and kinetic differences between walking in patients with and without femoral acetabular impingement. Okay, I hope I didn't say that too fast. Feel free to rewind. Okay, so this one is mainly focusing on the idea that surgery is not the only thing that you have to do for these things. Rehab and gait retraining is actually a very important thing, because patients and even people that don't have a lot of pain yet have limitations in movement across the board. Let's take a look back at the study and make sure I'm quoting it correctly, but let's see. I don't see anywhere about these patients actually having pain with this study, but for the most part, symptomatic. So they had symptomatic, or they felt pain within the hip, and they had guarded range of motion and altered range of motion significantly across the board with these with the people that didn't have it. So they usually have a control group that don't have problems, and there's a control group. In this case, they were people with symptomatic hip injuries, and also they were scheduled for surgery at the same time. So they noticed that these people walked slower with significantly smaller steps than the control group, and also they had significantly reduced range of motion in pretty much every range of motion of the hip. What this basically comes down to is that I like to say the analogy with let's just say there's a piece of drywall. If I just keep punching it or kicking it, eventually I'm going to break a hole in the drywall. And this is what happens with soft tissue injuries and cartilage and labral tears. You eventually just break a hole in it, and it's not, or you eventually pinch it away. It doesn't always have to be with large trauma, like we said in the last podcast. This one can just be kind of continually punching. A procedure to go in and correct it, a surgery, is to repair that hole. And I have no problem with that. I think it's great to be able to repair the hole when there's a hole there, but you also have to stop the punching as well. So a lot of times these altered movement patterns and changes in muscle activation patterns, it's a big problem, because we all know habits don't form overnight, and they're also not adopted overnight either. And I think generally speaking, I think if you do something for about a week, it's probably more so becomes habit. I think in an article I read, I want to say it was like 67 days is what they said. But either way, a lot of these people that have hip injuries like this, they have it for a long time if they're scheduled for a procedure to recorrect a labral tear. So here's what I'm suggesting, is that you have to take rehab seriously. You have to take gait retraining seriously. And if you don't know what gait is, I apologize, I should have mentioned that before. Gait is just normal walking, running pattern. How you take your steps, how you use the rest of the leg and core region to coordinate steps and movement. So basically, you need to retrain this, and there's no way around it. the procedure to recorrect the hole is sometimes needed. It's not always needed, but it's sometimes needed, but it won't change muscle activation patterns and movement patterns. So it's like I said at the other podcast, it's your responsibility as a patient, as an informed person in general, to know what your body is doing, know the anatomy, know how the body functions, know about muscles, tendons, cartilage, joints, ligaments, know about all that stuff, because you can have really good educated conversations with people in the field doing the work to you or for you. I think passive therapy is dead. There's no way that people should come into clinics and have stuff done for them and they walk out not knowing exactly what happened. They should know all this stuff. I apologize, I just swallowed a bug. All right, so if you want to check out this article, it is on the website. That is p2sportscare.com. If you have not signed up for our email feeds, please do so. There's tons of free information on there on different types of conditions and pathology. The YouTube channel I put together is huge, and it was my effort to really get people to understand what's going on, not just give them quick fixes. So thanks, and I hope to talk at you or educate you guys next time. All right, have a good day.